work 3 jobs sake of poverty. My daddy known as Manly, cause that's all him can afford for give it bi-monthly. Please bring Shira a little nearer. You hear her? Children, speak out against poverty. Malnourished picnic. 1 man with 6 car, 5 house platinum chain, CEO. Oh no! Do you really care? Look at your scornful stare. Beware. Are you see what we are talking? You see me now. Children, speak out against poverty. Watch him let me talk. I'll do my mouth dirty. Skin full of rush. What it all hurt me? Lord God, hunger just girt me. Just girt me. Gangrene brains, sewage lanes. Guns more expensive than houses. Chinks, roaches, crab louses. I see you all sweating. Allow me. Leave me, let me express my grouses. My grouses. When me speak, me know why you like me. When me speak, don't try to fight me. When me speak, you not fi highlight me. You not fi write me. Close your eyes. You don't even fi sight me. Germs. How what you try to do? Spite me? Spite me? Me so poor. My gum sore. Me can't talk no more. Let the drums speak for the voiceless. Let the drums speak for the voiceless.
See that? Few months so him can't talk. So super we have to start back. Life rough. But right now, do we have me pour my hand so me can't play drum no more?
Children, speak out against poverty.
I want to thank you for your invitation to launch the global study on child poverty and disparities. It is fitting that the study is being launched during the Caribbean Health Research Conference, and while the world is observing the 20th anniversary of the United Nations Convention on the Rights of the Child, for which Jamaica is a signatory. I must recognize the work of United Nations Children Fund, UNICEF, for the fixity of purpose, its singular vision, and its unparalleled work in advancing the cause of children and promoting children's rights across the globe. No one can deny the enormous contribution UNICEF is in developing a global policy framework and governance structure to hold governments. Oh, Michael, I want to say that again. No one can deny the enormous contribution of UNICEF in developing a global policy framework and governance structure to hold governments the world over accountable for creating a world fit for children. This study that was undertaken by a team from the Department of Economics, UWI, provides important information on policymakers and technocrats on the effectiveness of our policy interventions and gaps that exist based on evidence. We at the Ministry of Health welcome the results of the study and the recommendations that have been made. The Ministry is a lead policy entity in realizing the Millennium Development Goals and in working toward developed country status in keeping with Vision 2030. It is imperative that we have at our disposal robust monitoring and evaluation mechanisms that will inform policy agenda. I would like to speak generally about the findings, particularly as they relate to health. The study has found that most severe deprivation of Jamaican children was estimated for health at 9%, followed by water at 5%. Admittedly, the country has experienced some slippage in the area of immunization, and our infant and maternal mortality figures have not changed significantly over a decade. Jamaica has been a leader in the English-speaking Caribbean and has prided itself in eradicating diseases through the expanded program in immunization. While we have maintained relatively high vaccination coverage for many years since 1985, our vaccination coverage now averages 83%, with the exception of the MMR at 77%. Our target remains 100% notwithstanding, and we therefore need to strategize on reaching those children who are not yet covered. There are a number of initiatives that we can introduce to close the immunization gap. 1. We can make it mandatory for caregivers to produce the immunization card for all patients up to age 18. We must seek to be prepared to offer immunization services at every point of the healthcare delivery system. 3. Use the law governing immunization to prosecute persons who prevent children from being immunized. 4. Strengthen collaboration with the Ministry of Education and the Early Childhood Commission to ensure that all children that are admitted to school are adequately vaccinated. 5. Utilize public-private partnership, especially with healthcare providers in the primary healthcare setting, to routinely provide immunization services. And 6. Undertake a public education program on immunization. I spoke earlier of our infant and maternal mortality rates, that Jamaica has comparatively low child and maternal mortality rates, which explains why the targets of reducing by 2/3 and 3/4 respectively are difficult to achieve. Our infant mortality rate has declined some 51.5% per 100 live births in 1960, based on vital statistics from the RGD, to 25.7% 1,000 live births in 2007, according to the data collected by Statin and UNICEF. The proportion of live births attended by skilled health personnel is 96.1% based on last year's data collected by the Ministry of Health. We still have a difficulty relating to the shortage in midwife cadre, which stands at 47%. This impacted negatively on our efforts to improve our infant and maternal mortality. The Ministry of Health covers the tuition costs for midwifery, training, and we are encouraging persons to take advantage of this opportunity. It would be interesting to see what the next survey of living conditions will present in terms of deprivations in health sector, given the abolition of user fees. Ladies and gentlemen, the study recommends that some additional dimensions of child development, such as security, environment, and family life, be included in the study. I concur fully with that recommendation. The matter of security is a major issue in Jamaica and could also impact the frequency of deprivation in health if the free movement of people, both of the healthcare provider and for the patient, is restricted. Finally, no one in this room will disagree with me when I say that the future and fortune of Jamaica and Jamaicans is inextricably tied and linked to a strong rights-based agenda for our children. It cannot escape us, neither at the level of policymakers or the level of street bureaucrats, that there is significant strategic value in investing in our children. I urge organizations such as UNICEF to continue to be strong advocates for the world's children and to hold governments around the world accountable for achieving these ideals that are contained in the 1924 Geneva Declaration of Rights of the Child, the Universal Declaration of Human Rights, the Millennium Development Goals, and a world fit for children. I take great pleasure